DGHI is a really exciting place to be these days. It feels like almost every month there's a new faculty member and a new activity, new research project going on here. And so by being part of the Global Health Institute, I've been able to get a much richer view of that research process in global health. I'm Chris Paul. I'm a PhD student in environmental policy at Duke University. I'm also a Global Health Doctoral Scholar at the Global Health Institute. For me, the Global Health Institute is central to my Duke experience. Previously, there weren't many avenues for students from outside of the medical field to get involved in issues of public health. But since the start of DGHI, students from almost every graduate school and program at the university have been actively working in issues and research in global health. As a student at Duke, a university that's really driven by this idea of knowledge and service of society, I want to be part of projects here at Duke that really effectively apply knowledge earned to problems. And I want to be part of projects that are relentless in pursuing that goal of making a difference. I do fieldwork in East Africa, in Kenya, Tanzania, Uganda, and Ethiopia, looking at issues including malaria and climate change and water. I've worked specifically on studying the policymakers' perceptions of barriers to the implementation of malaria policy. One of the major issues that we have found and worked on is that malaria policymakers working on the medical side don't necessarily interact with those in the agricultural or environment sectors, where vector control for malaria, mosquito-borne disease is extremely important. In addition, we're interested in the relationship between climate change, groundwater, and health in the Rift Valley of Ethiopia. Much of the groundwater that people are so reliant on is contaminated with fluoride. Ironically, fluoride, which is good for dental health in small levels, at higher levels causes fluorosis, quite a serious and lifelong debilitating disease. For me, the Global Health Institute provides the means to be an intellectual leader in global health. I feel that the breadth of my experience with projects at DGHI has really prepared me for work in the field.